My name is Steve Alderman. I am a co-founder with my wife Liz of the Peter C. Alderman Foundation, dedicated to the memory of my son, who was in the World Trade Center on September 11, 2001 when the terrorists struck. He was 25 years old when he died. As his family, we felt it was appropriate to honor his memory by taking care of people who had survived mass violence in the form of terrorism, terror, civil war, genocide, etc., but who were unable to lead their lives because of emotional problems. Because of that, we came to Africa, first to Cambodia and then to Uganda, and set up clinics to take care of the victims of war. Shortly thereafter, in 2007, I came here and met the founding director of the African Mental Health Foundation, Professor David Nate. We became friends and colleagues, and set up at that time the first psychotrauma conference done in Nairobi, Kenya. Today, in 2015, we've had 8 conferences, with 3 of them in Nairobi. In fact, all 3 have been done here in Kenya, in the Catholic University of Eastern Africa. The purpose of the conference is to take care of those who take care of people that have suffered emotional wounds of trauma. Over the past 8 years, we have trained more than 1,500 people from 22 countries around the world. The conference is open and free to anyone on the African continent that cares for people who have been traumatized by war.
When we started holding this conference on the Kenyan soil, our focus then was to sensitize people on issues of mental health and trauma. So at that time, our audience was very widely based. We brought lay people, we brought in people who had been traumatized. Actually, all we wanted to do was to make people know that trauma was a big issue. I think we succeeded very well that time. Then the second conference we had was about, let us now talk about trauma, how it affects all of us, the issues that are important related to trauma. Now this time, we focused more on the academic approach, research, what people are researching in this country and outside the country, what they are finding, and how the findings of those research could be used for purposes of prevention, treatment, and intervention. And we will be looking at how psychotrauma affects one generation, then rolls out to the next generation.
My name is Dr. Victoria Mutiso. I work with the Africa Mental Health Foundation as the Director for Research and Administration. And I also am part of the secretariat that is convening or has convened the 8th Pan-African Psychotrauma Conference in Nairobi from 13th to 16th of July 2015. I'd like to say something about Africa Mental Health Foundation, which is a non-governmental organization which was formed to do research in mental health across the lifespan. And while we have been doing our work, we encounter a lot of people who go through trauma, and so that's how Peter C. Alderman Foundation discovered us in Kenya as partners to do this work in trauma in Kenya, as part of some of the African countries where Peter C. Alderman Foundation is working. And so we partnered to put together a clinic to provide psychotrauma services to individuals who had gone through traumatic events, and especially after our post-election violence in Kenya in 2007-2008. So our clinic at the Woodley Kibera started right there for the purposes of addressing the aftermath of the violence that we experienced in Kenya. And for that reason, we usually convene the psychotrauma conferences in Kenya as partners of the Peter C. Alderman Foundation. This is our third time to organize this conference among the 8 conferences that have gone around in the African countries. And we are really excited at the third opportunity and again at the 4th opportunity to host the next conference at the same venue in July.
My name is Shukri. In front of you is Sawakal Cultural Group, ready to perform a traditional Somali dance called Danchop. Actually, we normally do this to prevent youth from joining gang groups and also not to be radicalized. And we also perform such conference to gain knowledge and also to do mobilization in terms of forums like peace. I hope you will enjoy. Thank you.
Hi, this is Sadio Haji Abdurrahman. Originally I'm Somalian, but I grew up in Canada, Toronto, and that's where I'm coming from. I'm a doctor. I just graduated, got my MD degree, and I wanted to be a psychiatrist in the future. So I was fortunate enough to meet Dr. Maimouna. She works at Tawakkal Clinic, and she told me about this program when I arrived in Nairobi, and I was so fortunate to be here. And I always wanted to have a good exposure about things that happen with societies and how it gets affected. And I'm so great to see people, how they give their time in and how they work toward relieving stress and helping populations that have been affected by war.
My name is Mark Jordans. I am a senior lecturer at King's College London, and I am head of research for HealthNet TPO, a Dutch NGO. So this is my second time at the PCAF annual conference, and it's very nice to be here. For 2 reasons really. One is that I think it brings together an amazing group of people that are very motivated and engaged around the theme of mental health, of course. And I think it's really nice to get a sense of what's going on in the region in terms of mental health initiatives, in terms of research. It's a fantastic opportunity to have an exchange between researchers, practitioners on latest developments, but also on the status of the mental health situation in the different countries in the region and the needs. And that's very important for my work because I'm setting up mental health systems or researching mental health systems in low and middle income countries, and not just here, but to be able to learn from other colleagues and learn about the needs really helps me to in my work. So it's a very useful conference. And I've gone to several, actually many conferences, and this is really one of the most vibrant and dynamic ones, so it's very nice to be here again.
Hi, my name is Segane Musisi. I'm professor of psychiatry from Makerere University in Kampala, Uganda. I'm a consultant with the Peter C. Alderman Foundation, and I was one of the very founders of PCAF in Africa. I have been with them from the beginning up to now, which goes for about 10 years. We started off slowly with a pilot clinic in Tororo in Uganda. We opened up more clinics in northern Uganda, which was at that time still within conflict, and now it is post-conflict. We now have 4 clinics there. We came to Kenya, we've been to Rwanda, we've been to South Sudan, and we want to go to Burundi, and of course in Tanzania also. Trauma has bedeviled our continent, and the consequences of it are felt by everyone, not only in mental health, but also in driving some of the illnesses that we have, especially the epidemics of HIV/AIDS, of Ebola. We have to agree that these are happening in most of the conflicted countries on this continent. From the clinics, we began to hold these conferences to be able to share our ideas of helping people victimized by trauma, having problems coping, putting back their lives, our experiences in helping them, to share them with the rest of the world, and also get more knowledge and skills in doing this job. We established a journal to be able to publish these things and again talk to the world, and would like more articles from everyone about situations of trauma. This conference is being held this year in Nairobi, so will it be next year. And hopefully we can go around the East African region. We've had them in Tanzania, we've had them in Uganda. We would like to have them also in other countries to be able to share more about our experiences of how to help people who have been traumatized. I think this is what I would like to say. This conference has been very good for this year. Unfortunately, we're experiencing more trauma. We would have wanted it to be a little bit more enthusiastic, more probably with bigger attendances, but because of security concerns, it has had to be very contained this year. We hope that we'll not have to traumatize each other more, so that we can open up our ideas to wider audiences in a more open way.
My name is Dr. Frank Masao. I'm a psychiatrist currently based in Tanzania. I'm also the Mental Health Association of Tanzania chairperson and the head of Department of Psychiatry at Muhimbili National Hospital. I'm glad to be in this 8th Psychotrauma conference in Nairobi. I've been in these conferences for several years, starting from its inception and in Uganda for the first time, but also then an opportunity to have this conference in Dar es Salaam. I could generally say these are very, very useful conferences for both practitioners, for students, and also people who are affected, especially the war-affected regions. It is a conference that allows people to be able to talk about the trauma, the psychological trauma, a trauma that is always invisible. In many of the war taking place, people always see the physical effect of war and trauma, but the psychological part of it is always missed. So it gives us an opportunity for professionals, practitioners, to get understanding of what is happening on the continent, especially the Eastern continent, with regards to trauma, especially psychotrauma, and also it gives us an opportunity to understand what is going on, what are the updates worldwide, and what are the new development of knowledge, skills, and practices when it comes to addressing the psychotrauma in most of the countries that are affected. In particular, my country, we could not say we are directly affected with war, but we host a number of war-affected immigrants from neighboring countries where there is ongoing war and internal conflicts. We have a couple of people who have been affected, especially the urban immigrants that are trying to run away from the effect of war, etc. But also we have another invisible psychological trauma. This comes from rape, comes from gender-based violence, and many other misfortune that human being suffers. But unfortunately, because the trauma is not visible, we always skip that one and deal with the physical trauma. And for that matter, it's an opportunity for all of us to get exposed, understand, and be part of the processes of healing the psychological trauma.
I'm Alima Somosomo from Tanzania. I attend the 8th annual Pan-African PCAF Psychotrauma Conference at Nairobi Catholic University of Africa. So I gained more experience in this conference about the trauma and how to help a mental health person and people through this conference. So I gained more skills, experiences about how people suffer from trauma situations and how I can go on to help these people. So I'm happy to be here, and I want maybe one day to come again for another conference.
Better still, don't share experiences alone. Networking with individuals, with families, with communities, with organizations in all settings, at all times, and at all levels, from one generation to another. That never again shall we have conflicts of the magnitude that we are seeing. We need a global transformation for peace. We need a global transformation for prosperity for all. Ladies and gentlemen, we are now moving into sustainable development goals. Does it mean the previous ones were not sustainable? I think we should be going for equitable and accelerated development goals, because I don't want to die before I achieve what God put in me. At the same time, I don't want me alone to enjoy the sweat and the fruits of my life. I want the 1,000 generations after me to be blessed through me. And if I make a mistake, I only want 4 to be cast. Ladies and gentlemen, I'm not taking your time. I'm simply excited. I'd like to say, let us partner together and bring about a change. You see, when it comes to leadership, people say they never move until one person takes one dare in one state and everyone else follows. But the purpose of a leader is to be the first to take the step and make mistakes and learn from it. It's called experiential learning.
Yes, my name is Mohammed Hashim from Africa. I work with Africa Mental Health. I work with people in Isli. We work with people who use HAT and have PTSD. So we are here in this conference to understand more about PTSD. So basically we are here to help, to learn more about PTSD, to go back in Isli and to help our people there who use Mira all day and who have experienced trauma.
My name is Liban Abdulsalam Mohammed. I'm from Tawakal. We actually work with the youth, those who are from Somalia and those who experience a traumatic events like a war or anything else. And I'm here to understand more about trauma and what is PTSD and trauma. And I met with professionals from all over the world and some people who are like us, traumatic nations, from traumatic nations like Burundi, Uganda, Rwanda, and they experience the same Somalis experience. And I think this will help us to help our people and to understand what they are experiencing and how to overcome.
Africa is really awash with conflicts. At one time I counted there were over 15, all the way from the Cape of Gibraltar to the Limpopo River. Now with Boko Haram in the north, Xenobobia in the south, Al-Shabaab in the east, mineral fights and other things in Congo. Ladies and gentlemen, we do not know the effect all these conflicts have on the current generation and future generation. There is a whole generation in Somalia that has already lost their lives. I worked in Somalia for 3 months, in Somaliland, Puntland, and Baidoa. And I could see the impact some of these conflicts had on generations. I've gone up to Gaza to see a curfew that is from 6 in the morning to 9 in the morning for 3 years. What kind of schooling will the children have? I retired from the UN from Pakistan when I saw what it means to have war. Ladies and gentlemen, this conference, I would like to congratulate the organizers and therefore my salutations. After rather a lengthy opening and thesis of my presentation, ladies and gentlemen, the following social and business entrepreneurs have made it possible for us to be here today. First, Mount Kenya University, the founder and the Vice Chancellor. Secondly, I'd like to acknowledge the Vice Chancellor of Catholic University of East Africa for hosting us today. The Chief Executive Officer of the African Mental Health Foundation. The Chief Executive Officer, Peter C. Underman Foundation. And I will not forget my teacher, Professor Detey, the conference convener. Distinguished conference participants. May I now begin addressing the issues surrounding trauma and mental health. I'm sure during the course of these 3 days, you will lay the foundation for understanding mental illness, what it means. Ladies and gentlemen, according to the mental health website, a mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. And I would say, what makes a suicide bomber is exactly what he believes, what he thinks, how he feels, what he says, and when the opportunity comes, boom, what he does. You can classify it as a mental problem or very serious trauma. The fact is, it also helps how to determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood, adolescence, through adulthood.
My name is Lukoya Tuoli. I am an associate professor of psychiatry from Moi University School of Medicine. I'm also a researcher, a mental health researcher focusing on trauma and PTSD. I mean, it's clear to me that the continent is home to many conflicts, and as a result we have produced a large population of people who have experienced many potentially traumatic events. I do not think we've done enough to map where these people are. I do not think we've done enough to help those that we have identified. And so I think conferences such as this are very important in coming up with strategies first to find out where these Africans are who have experienced many potentially traumatic events, and then to agree on which are the best ways of helping these Africans who are exposed to these traumatic events. And perhaps also to start thinking about what we as Africans need to do to reduce the amount of trauma that we put our people through. I think that is an important outcome that I would think we should see from conferences of this nature.
I'm Dr. Catherine Abo from Makerere University, a senior lecturer and a child and adolescent psychiatrist. I've enjoyed this conference, and for the first time in all the conferences that I've attended, they've looked at trauma across the lifespan, right from a fetus in the womb to perhaps to the grave. And this has been very stimulating in that the trauma and generally mental health in the very young have always been left behind. And I think this is a very good stepping stone for all the conferences that would come in future to use this as a stepping stone to look at especially psychotrauma throughout the lifespan. And I've also made a number of friends and networked quite a bit, and I hope to keep the network that I've made. Thank you.
My name is James Dongo. I'm from Presbyterian University of East Africa, a student in doing my bachelor's degree in theology. I'm happy to be in this conference, the 8th annual conference on psychotrauma. And this conference has really changed my life because I've been able to learn, and basically on issues to dealing with children, and also in issues to deal with violence. It has really changed my life, and also dealing with the trauma involved. And moments in this conference has been awesome, and I must say that even as you move there out, you have been equipped to be able to deal with some of these things, so these problems. I'm happy to be here, and the conference is awesome. The speakers are good. Thank you so much.
It always is a pleasure to have a lot of people coming from all over Africa and beyond. This time we have had 13 countries represented, most of which came from Africa, and which is basically the vision of the Peter C. Alderman Foundation, to heal the wounds of those that have suffered from traumatic events, ranging from bomb attacks, terrorism, or even physical violence from either partners or other forms of violence. And so we were really excited to host this conference. We had tons of people excited, and a lot of scientific material that was for everyone. It covered policymakers, researchers, trainees, faculty members, survivors of trauma, our own user groups, including refugees. So there was everything for everyone, and it was really, really exciting to be able to host this conference at this magnificent venue.
In the beginning, Dr. Nate and I and Dr. Mutiso lent our full energies to organizing this conference and to overseeing it. Now they have become they have gained so much expertise that they have even delegated it to African Mental Health Foundation employees. This conference is probably the best we've ever had here. It is the smoothest. It is a complicated undertaking because we bring in a distinguished global mental health faculty from around the world, around the globe, and we fly them in from such places as Sri Lanka, Boston, the United Kingdom, Great Britain, etc. And things have just gone like clockwork. We estimate, we don't know the numbers yet of attendees, but it's upward of 650. I think it's probably 750. Each conference has a theme, and this year's theme is treatment of trauma across the life course. Professor Nate made a bold, I think, move this year, and in an inspired way thought of bringing in young people, that is people who are still in college. The hope of sub-Saharan Africa to relieve its huge burden of PTSD and traumatic depression is to have more and more personnel to take care of these patients. To do psychiatric or mental health psychosocial services, you do not need an MRI in every village. What you need is trained and dedicated people. Professor Nate has the idea, and I think, again, it's transformational, is let's get hold of these people and let's appeal to them young and catch them early so that they can decide on a career in mental health.
I think this meeting that has just ended has been very successful. Unlike other meetings, we were able to focus on young people, upcoming researchers from different universities, from Catholic University, Presbyterian University, University of Nairobi, Mount Kenya University, and several other universities, both public and private, in this country. The importance of this can be underlined by the fact that also the faculty, the teachers came along, and we had several deans of medical schools who came here underlying the academic approach to the psychotrauma. And during the opening ceremony, we had several vice chancellors gathered here to talk about psychotrauma, and again an indication that universities are taking this issue seriously. As a teacher myself, the focus is on the next generation who will take this work to the next generation, and therefore I'm pleased to say that we had a very big representation from students, both undergraduate and postgraduate, and some of them doing their PhDs. So I look forward to seeing all of you next year. Please do come along. We'll be meeting in this wonderful facility, which enabled us to have good food, good environment, also to network, and equally important, to have a lot of fun. I have been to very many conferences, but I don't remember seeing a conference hall all of it being turned to a dancing hall and everybody dancing. Thank you.
Past 7 years, it is my honor to present the Convener's Award to the conference convener, and this is the third such award I've had the privilege of presenting to Dr. Nate. His career has spanned over 3.5 decades. He is a scholar who has contributed substantially to the evidence base. He is a teacher who has produced cadres of physicians and PhDs and others. He is a teacher. He is a tireless advocate for global mental health. And he is a social entrepreneur, as evidenced by the Africa Mental Health Foundation and this conference. It is with great pleasure I present to him the Convener's Award. This is an immensely rewarding venture for me and for the Peter C. Alderman Foundation. Based on this, the African Mental Health Foundation and my group started a clinic in Kibera. It's called the Woodley Clinic. We got it up right after the post-election violence, and we see patients there every day and have for a number of years now. And it's an addition to the community, and it's a value added for Nairobi. And in fact, the City Council helps us to underwrite it. This whole venture has been very worthwhile, and I am terribly delighted that I'm here now and that I'm continuing on this trajectory. Thank you.
And then Uganda, get ready.
Wow.